Hello, everyone, and we are live. So thank you again for joining another Power Panel sponsored by MyosMD. Just wanted to thank everyone again for those of you who are tuning in live and those of you who are listening to the recording. Before we get started, I wanted to mention that today's Power Panel is brought to you by MyosMD, the cutting-edge nutritional supplement designed to combat muscle loss and support healthier aging. Powered by Fortetropin, a natural bioactive compound clinically shown to enhance muscle growth and reduce anabolic resistance, MyosMD is changing the way we think about muscle health. So that leads me to our guest today. Ilene, if you don't mind introducing yourself and telling us a little bit about what you do.
Of course. So I'm Ilene Cohen. I'm a registered dietitian nutritionist. I'm also a certified diabetes care and education specialist. I'm a yoga therapist and an Ayurvedic practitioner. So I wear many hats. And I really got into this, because of my own personal experiences. I was, I'm in a private practice. Now, I was in a very stressful corporate job. This was back 15 years ago, not to age myself. And I was working 80-hour weeks. And then it dawned on me that I should get into yoga. I should do something else for stress reduction. So I started practicing yoga. Needless to say, I quit my corporate job as a dietitian. And my father always said to me, never quit a job without having a job, right? But the point is I quit, and then I started enrolled in a yoga teacher training program, became a yoga teacher. Years later, became a certified yoga therapist. And then now I incorporate all assets of yoga therapy, nutrition in my practice with my clients and patients. And then the rest is history.
Amazing. And so a little bit about what you do, as a nutritionist, as a dietitian, is nutrition based, of course. And so
Yes.
we'd love to hear a little bit about, functional nutrition, how you define it, and how you see functional nutrition playing a pivotal role in improving patients' lives.
Totally. So functional nutrition essentially gets to the root cause of a disease or a condition. It doesn't just look at the patient's symptoms, for example. It really digs into sleep, the environment, looks at genomics. And I think one of the hallmarks of functional nutrition is actually in the testing that they do. So they have different functional nutrition tests that can be done that I work with in my practice. And it's more than just looking at blood work, because, when we get standard labs, right, maybe the calcium could be high, but that doesn't mean that it's getting in the cells of our body, right? So one thing that functional nutrition does that I think is really unique is that it looks at the ways that the nutrients are interplaying in the body, in the cells, at a cellular level. So it's much more than just, the surface, right? It really digs deep and goes deep in.
Yeah. And what are some of those other tests if people are not familiar with, the type of functional medicine testing that you do?
Totally. So there's micronutrient testing. I know I work with a couple labs, different labs. One is Genova Diagnostics. And so this looks at, again, the different nutrients at the cellular level. They have food sensitivity testing, which is one of my specialties. I really love it. I have great case, stories and all that of success. We have genomic testing, which is very new and up and coming, right? Some of the single nucleotide polymorphisms, or SNPs, are certain variants in the genes that play a role in the way people metabolize nutrients. So this can be found in some of those tests. And what else? They have GI tests that are like stool tests that can, and a lot of these tests, I want to say that they're not diagnostic. So that's important to know. They'll more show the imbalances in the body in terms of like the microbiome. But then what's great is that if the patient exhibits symptoms, if the patient has signs, symptoms, or something comes up on the test, they can follow up with a diagnosis, right? I might refer those patients to a doctor who can actually get, for example, SIBO. And that's an example, right? It wouldn't show up on the functional nutrition test on the GI panel, but it could indicate that more work needs to be done, and then they can actually follow up with a SIBO breath test.
And it's about that combination of the clinical discretion, so your clinical discretion with the
Yes,
actual test results, right? So it's not
totally.
diagnostic in that this test is saying,
It's
oh,
not
this patient has
diagnostic.
this. It's instead, okay, let's
Correct.
put all of these pieces together. And as an
Exactly.
integrative pharmacist, I resonate with that because it's like,
Oh,
how can
yeah.
I look at all of the tools that are in
Yes.
my tool belt? And for you, some of those tools are, the yoga therapy, the
Exactly.
Ayurvedic principles, but also these functional medicine tests.
Functional medicine tests, exactly. And I just wanted to stress that it's not because, as a dietitian, nutritionist, we can't diagnose, so the tests are not diagnostic, but they do tell what their imbalance is in the body and if there's certain things that need to be addressed.
And you mentioned that one of your specialties is food sensitivities or food intolerances. Can you
Yes.
talk a little bit about like what you're seeing, any trends or any like,
Yeah.
recent, whether it's like advancements in the field or trends that you're seeing amongst patients? I'm so
Totally.
curious.
No, I mean, it just brings to mind a patient that I had. She was, I mean, because what the food sensitivity tests do is identify, they look at it's very interesting. Okay, there are different food sensitivity tests. Let me start out by saying that. Now, some of them I think are much more inaccurate than accurate. The one that I use, which is called the MRT test or the Mediator Release Test, is highly accurate because it doesn't just look at the IgG or the antibodies, because as we know, like just because somebody has an antibody to a certain food doesn't mean that they're sensitive,
Correct.
right? So the truth is it looks at the different water shifts in the leukocytes in the white blood cells, and then it shows the response to certain foods. Now what I found is that, I mean, I had this one patient, I will not forget her. She came with major hip pain, and what we do is she had menstrual pain, hip pain. We do a symptom survey, which is really interesting. So it's a numerical survey that looks at the different symptoms the patient has on a numerical scale, and then they get a number. So this patient came up 125, right? Very high. Did we eliminated, we saw the foods, so it shows you in a traffic light type of system the way the foods are reacting in the body, which are highly reactive or red, moderately reactive yellow, non-reactive green, but it shows also the ranges. So we start out eliminating those red and yellow foods and then introducing slowly the green foods. And when I say green foods, I don't mean just like vegetables. I mean like the ones that are non-reactive. And she went down. We did a follow-up symptom survey after 2 weeks of being on the diet, and she went down to a 40. So she had almost a 70% improvement in her symptoms based on just eliminating foods. So that's interesting, right? Because food sensitivities can result from some of the imbalances in the body. But it's like if you're having those foods, you're having more inflammation in the body. So it's really focused on reducing that inflammation.
Yes, definitely. And then could you speak a little bit about how Ayurveda or Ayurvedic principles play a role in this approach to personalized nutrition?
Definitely. So I love Ayurveda as an Ayurvedic practitioner. So Ayurveda, just to kind of define it, is a ancient medical science that originated in India years and years ago. And it looks at the imbalances in the body. Also, they're primarily diet-based, lifestyle-based, and herb-based. And they're constitutional-based, which means that they look at the dosha or the unique makeup of each person, and then they come up with an assessment that determines, okay, is this person, for example, vata, pitta, or kapha, which are the three different doshas, right? It's interesting. Those of you who might know a little bit about it, but a lot of people say, well, what is vata, pitta, kapha? So vata is like the wind. Think of it as like the very rapid movement, right? So a lot of times they need calm and grounding to balance, right? So the dietary therapies, the herbs, the lifestyle, meaning like massages and all that, will be geared toward reducing that movement, right? To bring them in more grounding. Pitta is the fire. So air and ether is vata, water and fire is pitta, and then so they have like a lot of heat in the body, right? So that needs to be reduced through cooling practices, cooling massages, cooling foods, cooling herbs, whatnot, and lifestyle. And then there's kapha, which is earth and water. So they need a little bit. They need a little bit more kind of like increase in energy because they could be energy deficient, right? So that's a little bit about Ayurveda, and I love it, and I use it in my practice with my clients and patients by determining what their dosha is, and then using it in conjunction with the different testing that I do to come up with a game plan for them, a nutritional plan.
Yes, amazing. And so a little bit about my background. So I actually taught some Ayurvedic nutrition and
Oh,
movement
did you?
classes at a
Oh, that's
college of traditional
wonderful.
Chinese medicine a few years ago.
Oh,
So
that's
I'm
awesome.
I'm a little, like nerding out over here
So
about like what
over
you're
there,
saying. And
it's all
because
coming back to you.
yeah, exactly. And coming
Concept of
from the
the
like
different doshas.
yes, exactly. And it's so important because it's like there's so many people that talk about functional nutrition. There's so many people that talk about Ayurvedic nutrition, but very
Right.
few people that talk about how are we using them together as two
Exactly.
tools. Um,
Exactly.
and so I find what you're doing really like, for lack of a better word, like revolutionary, just because
Oh, thank
I
you.
don't know anyone else who's really thinking about both sides of the coin.
And it's really combining Eastern and Western medicine
Mhm.
practices when you think about it, right? Because but it's not Chinese medicine, although Ayurveda has some roots in Asian Chinese medicine, but it's really like a very special system. So I
Yes.
love it. And I love how it's so holistic and integrative, and it's really, I just mention also that it's really integrative from the standpoint of we're not saying don't use medication. Like that's not it at all. It's just that there's also like they might need less of certain medications if they do certain lifestyle practices. So you're familiar with all those great massages, right?
Yes, absolutely. And I love that definition of integrative because everyone has their
Yeah.
own definition in the space, or at least that's what I found in
Mhm.
the last decade. And so some
Right.
people are very, pro-prescription, some are anti-prescription, and some
Correct.
are just trying to figure out what's the best for the patient. And I feel like I kind of
Exactly.
lie right between, where if a patient comes into the clinic and they're on 6 medications and they're fine about those, but they want to figure out
Totally.
how they can optimize their digestion or they can optimize their sleep, like let's not think of a prescription, let's think about some of these integrative things to do in combination from a
In combination.
safety and efficacy standpoint.
That's right. That's right. Agreed.
Yeah, amazing. And so I would love to shift to what a lot of people are talking about right now, which is protein. um,
Okay.
Protein paradox. Everyone's talking about, oh my gosh, how much protein should we be eating? So I would love to get
Yes.
your take from the functional nutrition perspective.
Yeah,
How much
totally.
protein should we be getting? And how much should our patients be getting?
Totally. And we are our patients, right? We're all the same, right? We need that protein. So what's interesting is that, a lot of studies are coming out now, like you mentioned, it's a hot topic about protein. And what they're seeing is that what used to be recommended, which is like your zero point 0.8 grams per kilogram of body weight, is just not enough anymore. Right? People really need significantly more, especially to build muscle, right? Because you need those amino acids, the breakdown of protein to really so what we're looking at is more of closer to at a minimum of 1 to 1.2 gram per kilo. But the truth is, if anybody's doing any sort of strength training, resistance exercise, they're going to need more closer to 1.2 to 1.7 grams per kilo. And sometimes if older adults, the older we get, the more protein we need, right? Actually. So they're going to need even more, like even up to closer to 2 grams per kilogram if they're lifting weights, let's say. Right. So really, we really need a lot more. And what's interesting too is that a lot of people say, well, it's easy to get enough protein, but believe it or not, I see patients every day that are just not getting enough. Really, they're not. They're eating oatmeal for breakfast, and then when I ask them, well, what do you eat with the oatmeal? Do you eat anything with the oatmeal? That it's just the oatmeal, right? If they're eating oatmeal, even, or maybe a couple slices of toast, and then they put some butter, but then they're missing that main protein source. So and then what that would translate, I always tell people, like, as a rough estimate, because you want to use your weight as a guideline, like clinically, I want to use their weight. But if just as a general guideline, at least 20 to 30 grams of protein per meal, and at least 15 to 20 grams of protein per snack. So what would be 7 grams of protein would be like an egg, for example. So if you would want to get your 21, you would need 3 eggs to get to that goal, or 2 eggs on a slice of cheese, let's say.
Yes, absolutely. And so you mentioned a few examples, but what in your opinion are some, high quality protein examples? That could be
Yeah,
animal based, that could be plant based. Like, what do you
totally.
oftentimes recommend for people to meet their protein goals?
Absolutely. Okay, so starting with animal based, let's say, which is going to always be, and there's nothing wrong with being vegan or vegetarian, but the truth is it's going to be more bioavailable in the body. You have your chicken, your meats. Now, when we say meats, because everyone's, oh my God, colon cancer, right? With too much red meat, you can always get good quality grass fed meats that can be incorporated in the diet. So chicken, turkey, I love, right? And a great way, like a great thing that comes to mind would be a great meal idea would be a turkey chili, let's say, because then you can combine, let's say, beans, which are an excellent plant-based source of protein, with the turkey. You have fish, and fish is so wonderful because it has omega-3 fats. So they're so good for anti-inflammatory purposes. Now, on the vegetarian plant-based side, we have a little more challenges, right? It's not, of course, eggs go without saying, they're a great source of protein. But then you have your tofu, you have tempeh, the fermented soy. Now, some people don't eat soy or are allergic or sensitive to soy. So you also have beans, right? Or legumes, right? You could have lentils are a great go-to that I recommend, and just something to consider when you're eating your beans or lentils. They're not going to be a complete protein, so they have certain amino acids in the beans that need to be combined to get a complete protein with, let's say, a grain. Right. So let's say beans and rice, for example, or beans and quinoa, although quinoa is said to be a complete protein grain, which is interesting. But they don't have, the vegetarian sources don't have a lot of protein. So you need more to meet your needs, right? So it's just a question of getting, and then there's also mixing in. So there's the macronutrient side, and then there's the micronutrient side, your fruits and vegetables, and making sure to get those antioxidants in to sort of give benefit to the protein to help it to metabolize better.
Yes, absolutely. And I would love it if you could speak a little bit about variety and the importance of, the diverse amount of, let's say, plants and animals and everything that people are consuming.
Right, totally. So when you're asking about variety, I mean, it's like how to get a varied diet, right? How to make sure to get that in your diet. So I always start by, of course, like asking the patient, because I don't want to tell anybody to do anything, right? And that's part of the functional nutrition, in my opinion, is also collaborative goal setting, right? So you're going to ask the patient, like, get a detailed history of what they really like to eat, right? Because it's like a question of, I've had patients that say they don't like salmon, right? But then what other fish could they have? So basically, just getting your different, you have your proteins, you have whether it's chicken or turkey, eggs, and then you have like your base, let's say a grain, right? A good rule of thumb is like half your plate with vegetables, the non-starchy vegetables, to make sure you're getting those antioxidants in. And a tip I always give to patients if they ask me, or if we're talking and they don't know how they're going to get those vegetables in, is to include two different color vegetables with each meal, because that's going to at least give you, like, let's say, beta carotene, different antioxidants and phytonutrients from the different colors, right? So that's a couple ways to get that variety in.
Yeah, that's amazing. And in my residency and everything, we called it patient-centered shared decision making. So it's that
Oh,
like
yes.
collaborative
Right.
teamwork of working with the patient and understanding what are the patient's treatment goals, and then how can
Yes.
I help be a guide with my educational background, with my integrative perspective to help them achieve their
So
goals.
true. It sounds like you had great training, Dr.
I
Newman.
really did. And I had
Yes.
amazing mentors.
Amazing. Because it's true. It's like a new age. We're no longer just looking at symptoms. We're no longer just telling people what to do. They need to really to be motivated. There's the whole motivational interviewing, right?
Yep.
And it's an
Mhm.
important part of nutrition counseling and just counseling in general. So that's a really good, tip for any healthcare providers out there that are wondering how to engage patients more, right, in their care. Like, I don't just tell them, okay, you might say like, hey, you could benefit from more protein, but well, what are some ways that you want to improve your muscle health, right?
Yeah,
Would be a good question,
exactly.
instead of just like, okay, you need to eat more cheese or more eggs or more, like what are some ways that you want to incorporate this with the foods that you love?
And
Right.
speaking of muscle health, I would love to dive into, now that we talked a little bit about protein, how
Yeah.
else do you personalize, care plans for patients when they're trying to optimize for, improving their muscle health, and especially as it
Totally.
pertains to longevity?
Yeah, so that's a great question. I mean, of course, there's diet, which we just talked about, but then there's also resistance training, right? I mean, it's highly recommended, and it's even one of the American Diabetes Association recommendations now for all people. I mean, I think everybody should be doing it, right? Because we all have some sort of muscle loss as we age. And that could just be like 5 to 10 minutes a day of lifting some sort of weights. It doesn't have to be like heavy weights, right? You can start slow and then go gradually up. But most importantly, it's so important for that muscle to do that repair, right? Because what I always teach patients is that we need the nutrients to help with the repair, but then we also need that muscle breakdown that happens for muscle protein synthesis. So when we're doing the exercising, the muscles will break down, and then afterwards they'll repair again, but only if there's enough nutrition to do that. So that's really key, is really combining both. Also, sleep is like underestimated, right? It's so important. It's a very important part of functional nutrition, because if patients aren't sleeping, they can't regenerate, right? They can't detoxify, the muscle needs rest too, believe it or not. So I think if the focus is too much on resistance training and too much on like, I'm going to work the same muscle group every day, you're not going to give it a chance to regenerate,
Yeah.
right? So
Hmm.
sleep, really taking like a detailed history of how they're doing with their sleep patterns, their lifestyle. Are they stressed, right? If they are, maybe they need some breathing techniques, right? And then I'll be working with them with some of my yoga breathing techniques. So it's really incorporating everything into play when it comes down to muscle health. So it's not just eating or just exercising, it's combining it all.
Right. And are there particular foods or supplements or anything you recommend to patients? And of course, I know this is like every patient, it's a
Right.
personalized decision, but are there
Totally.
some, that might be applicable to many patients?
Yeah, that's a good question. I mean, if they have certain nutrient deficiencies that we discover on the test, then they'll need supplements. And a lot of times, the another thing to consider is genomic influence. So, in other words, if they have genetically aren't metabolizing certain nutrients, they're not going to be able to absorb. So, again, functional nutrition looks at the test at the cellular level, the nutrients, and then determines. But then you have to look at why is this happening, right? So I would recommend then supplements to replete. And in terms of protein, I know that MyosMD has a wonderful product that is with raw fertilized egg yolk. That is that we're going to start trying soon. That I think is fantastic, because at the end of the day, whatever help we can get is important, right? We can't do it with just, like we talked about, with just the one tool, or just with what we eat, because if we're not able to absorb, or patients with GI conditions, maybe they have SIBO, maybe they have Crohn's disease, maybe they have certain conditions that affect their absorption of those nutrients, right? Or maybe they have some broken bones, maybe it's a little hard for them to strength train. So, we have to sort of meet the patient where they're at and work with them from there.
Yes, absolutely. And could you speak a little bit about, genetic testing? You mentioned it briefly. Or,
Yeah,
it could be about genetic testing, but also it could be about, what are the other advances in the functional nutrition space that you're excited
totally.
about?
Yes, I mean, I think genomic testing, I think, is amazing, because I mean, it really does look at the whys behind, like if someone's constantly low in vitamin B12 or vitamin D, maybe they have a certain gene, the variant that's not enabling them to metabolize those nutrients. So I think and I try to do genomic testing with my patients. Of course, there's an expense to it, but I think it's worth it, because it's a one-time test, right? Our genes are not going to change. So it really shows what their status is, and it can give you a lot of answers. So I'm a big fan of genomic testing.
I
And
really
I
cannot.
worked with a company called 3X4
Oh,
Genomic.
nice.
Yes, it's
Yeah, I
amazing.
was
So
gonna say, like, I really cannot wait till the day until like genetic testing is just the norm. And
oh
it's
yes,
just, you go to your PCP and you get
and you
your
can get
BMP,
genetic
you
testing
get,
too.
your lipid panel, you get all of your normal testing that you would get annually or maybe even more often depending on your,
Wouldn't that
the conditions you're diagnosed
wouldn't
with,
that be
but
fabulous?
also
And you
that
can
you get genomic testing when like let's say,
make
when you have a new provider or something, and that's just a
Oh, I
part of
think it would
your,
be incredible. I
yeah,
mean, it
then
would just
that's
give
just a
us
part
so
of it.
many answers, as would the micronutrient testing. You know what I'm saying? Like it would all be nice if it started being covered by insurance, wouldn't it? By health insurance. But
I mean,
as we
that's one of the
know,
main barriers, unfortunately, I think, as to why so
I
many
think
people
so
don't do
too.
it. It's not covered by insurance, so it has to be this out-of-pocket cost that just becomes, on top of everything else patients have to pay for. It just becomes,
Right.
it can become a lot for some people.
It can become a lot. Although I try to encourage, because I don't take insurance personally in my practice, so I try to encourage them with the information that they can give them and where it can get them. So in other
Mhm.
words, if they can like help, people always want to solve their problems, right? If they can get answers to why they're feeling a certain way or why they're not metabolizing nutrients, and they can get rid of their symptoms, but from really understanding the root causes, isn't it worth it, right? It's like the money becomes like just an investment into their health.
Yes.
So I definitely think it's worth every penny, and it's really only, it's a few $100s, but the truth is you have to look at it as an investment into your
It is.
health.
Yeah, it is an investment.
It's an
Yeah,
investment.
amazing. I would love
Yeah.
to hear a little bit more about how you mentioned a little bit about like yoga breathing techniques, but could you
Yeah.
talk a little bit more about how your, background in yoga therapy helps your patients?
Yes. So when they come to me very stressed, we'll just stop and we'll do some breathing, right? But even more importantly, like I'll give them like a yoga nidra, let's say, which is a yoga sleep type of it. Like I have some audios that I actually give my patients so that they can do it on their own. Because I think the most important thing is it's about using the tool and having it constantly, like on a daily basis. So it's not just like when they're in session with Eileen, right? It's I'd like to teach them how to do it themselves, so if they're ever stressed out, they can work with it, right? So it's really about teaching them the tools to incorporate and giving them some tools to get them started to incorporate it in their own lives. So I'll
Yeah.
use yoga breathing techniques. I'll do some yoga therapy with patients if they're open to it. Of course, they sign like a little release form and whatnot if we're going to do any sort of movement. But and this can all be done virtually or in person, which is great. My practice is primarily virtual right now, but I find that I can do this all virtually.
Wow. I love all the different modalities coming together and really personalizing it to the patient. At the end of the day, it's about empowering the patient to give
Yes,
them all of these different, things that they can try and see what
definitely.
works, what doesn't. And then it becomes this, really, really productive iterative process that gets them to their
Definitely.
goal, which is amazing.
Definitely. And there's so many tools out there now that we know
Mhm.
about them. And but a lot of people don't know about them. So, my mission is to spread awareness amongst not only patients and consumers, but healthcare providers too, so that they can start recommending them or looking into them or collaborating with other healthcare professionals, right?
Yeah.
To really provide a holistic integrative care
And
and really,
if, mhm. Oh,
oh,
sorry,
go
go
on.
ahead.
No, 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 you
I
go.
I was just gonna say that, we're coming up on time already. That was, like, maybe the
Oh,
quickest
wow.
30 minutes I've
That
had
was
in
a
a
fast
very
30
long
minutes.
time. And so would love to, ask you, if someone was watching this, a healthcare provider, and they're thinking about,
Mm,
okay, like I would love to share some information about nutrition, whether that's functional nutrition or otherwise, to really help their patients. What
yeah.
are maybe one or two of the key takeaways that you would love for them to walk away with?
Okay, great. So key takeaways is really listen to your patients, like take a little time, right? I know that time is of the essence, but just see what's going on aside from just their symptoms. Look at their environment, look at their sleep, start to look into their nutrition. And if you need to refer, there's always, we're always happy to work with patients, but see what you can do to go deeper. And also consider, another takeaway I think is consider functional nutrition testing, and know that there's actually a lab. Here's a really good tip and a good resource. There's a lab called Rupa Health, RUPA, and you can, as a provider, you can sign up with them for free and essentially order any functional nutrition test. And they even have training for providers. So if you wanted to order, let's say, a micronutrient test for a patient, let's say you wanted to order it from Genova Diagnostics, they have different tests you can look through. Essentially, you can meet with a practitioner who is in charge of that test about your patient's results. So they will actually teach you a little bit about the test, and then they have videos and webinars and tons of resources. So that's a really good resource, and that's what I would take away, recommend to take away.
Amazing. Well, thank you so much for your time. And
Thank you
if
so much
people
for
want to
having
learn
me.
more about you, where can they find out more?
Oh, yes. Thanks for asking. They can go to my website, which is www.pranaspiritnutrition.com. So it's prana, Prana, the word spirit, nutrition.com. And then you can find me there. You can find me on Instagram at the Ayurveda Dietitian. That's the Ayurveda Dietitian. And I think on LinkedIn right here.
Amazing. So as we wrap up, we'd like to once again thank Ilene for joining us today, as well as MyosMD for sponsoring today's Power Panel. Again, MyosMD has a revolutionary proprietary ingredient called Fortetropin that is trusted by many healthcare providers nationwide to deliver real results backed by science. And if you'd like to learn more about Ilene, please visit her website. And if you'd like to learn more about MyosMD, please head to myosmd.com. So that's MYOSMD.com. And there we actually have a full curated library of experts like Ilene talking about their expertise and really how it plays into improving patient outcomes. Yeah, amazing. Well, thank you so much and happy holidays.
So much. You too. Thanks, everyone. Bye-bye.